Let's talk about how to successfully launch telemental health services for a graduate program for the practicum program. And I am really excited to have with us Dr. Sheri Pickover to discuss this topic. She's a professor of counseling education at Central Michigan University. She worked as a case manager, therapist, and foster home licensure in the child welfare system for 20 years before obtaining her PhD. She created and led a no-cost mental health clinic in Detroit, and she now serves as program director of the CMU Counseling Program. She's the project director for the President and Provost Innovation Award 2020 that funded training to allow Central Michigan University Practicum Lab, the Center for Community Counseling and Development, to provide telemental health to clients at no cost, and trained addiction, school, and clinical mental health counselors to conduct telemental health under extensive supervision. So, Dr. Pickover, thank you very much for being with us today.
Well, thank you for having me.
Yeah, and most universities or counseling programs, they made that pivot very quickly because of COVID-19.
Mm-hmm.
And most people haven't had like major issues come up, but now they're starting to look at, well, how can we improve this? And one thing that I think is really remarkable is that you took the initiative before COVID even came about to start working on this within your university, wanting to really prepare your graduate students through their practicum program, and through that providing services to the community through telemental health. And you won an award for your work. So yeah, I think it'd be really helpful to hear about the process. So why did you think to do this before even COVID hit? And then we'll talk about the successes and the learnings.
Oh, what a great question. Well, Central Michigan University is in the middle of Michigan. And when most people think of Michigan, just like any state, there are areas that are densely populated and areas that are very sparsely populated. And Central Michigan is at a place that is very sparsely populated, northern Michigan. And as a result, many of those individuals have lack of access to any mental health services. It's not just, oh, maybe there's one or two. There are many counties in Michigan that have none. So what happened was in, I think November or December of 2019, our provost and president actually put out a call for innovation awards to the entire university. And what they were looking for were projects that were innovative, creative, and would push things forward. And actually, one of my colleagues, Dr. Arnekrans, had for quite a while been thinking about, we should be doing telemental health through our clinic, because again, we have lots of lack of access. And so as the project lead, me and the entire faculty kind of sat down, came up with a plan for all of us to get trained through the Telehealth Institute to get the certification to be telemental health providers, board certified, and then to be able to develop a plan where we would train our practicum students. We would do a pre-test, post-test, a really kind of extensive program evaluation, both from the side of the student and feeling, did they learn what they needed to learn, and how comfortable did they feel, that we would be able to supervise them closely, because of this, great one-way mirror system where we could actually watch them do telemental health, with their computers in our clinic. And then also we were using some screener assessments to determine the efficacy for the clients. So did the clients find that telemental health was useful to them if that's what they ended up signing up for? And so it was awarded in January of 2020. We had this wonderful plot out going, yay, great, we'll start it, and starting in August, we're going to prepare. We hired a brand new clinic director. He was on board, and, and then the world exploded.
Yes. Yeah.
So we had practicum students in the middle obviously, of the semester when the world shut down. Michigan shut down in March of 2020. But because we had already had this built, and we also had a great relationship with our HIPAA compliance office. So really, it was quite a village effort. So the HIPAA compliance office, within, I would say, 48 hours, had a online HIPAA compliant release for us to be able to begin this process. We already had HIPAA compliant computer systems available. We used WebEx. We already had the business agreements with them. We already had a system in place to do EMR. So luckily, we had a lot of infrastructure already set up that we could transition, and we did in a week. So within a week of us shutting down for spring break, we were back up. We, at that point, kind of scrambled to find, making sure our students get training, making sure we got training, because of course everything got pushed up. But that was kind of the history of it.
Yeah. So you notice that people in your community had a lack of access to services.
Mm-hmm.
And this prior to COVID, right?
Mm-hmm.
That's always been one thing that's been frustrating to me for years, because I've been doing telemental health for almost 20 years, is the resistance. And it's like, oh, it's second best and all this kind of stuff. And then the pandemic hits, and then they're like, oh, we need this. And I'm like, you always needed this, because there's always people that have barriers to access to treatment, no matter where you are. Like it's a real need for people, right? So you saw that need and you're like, hey, this is a really good initiative. So then you did a lot of legwork before COVID came about. And one of the first pieces that you did was, let's get our supervisors, our instructors trained. So you took our training. So glad you did. And then you all got awarded the board certified telemental health provider credential through CCE, to prepare the supervisors, instructors to train the graduate students. Yeah. And I could imagine that could be difficult, because I would imagine that some of the supervisors, instructors that got trained, but they may not have had a whole, years of experience doing it themselves. Right. Yeah. And then I really love how you assessed the graduate students in the beginning before they get training. And then after, you had them do an assessment, how they feel about it, their confidence and so forth. But then you also did that observation to see how they're doing in assessments. I think that is fantastic. And then when COVID hit, you were already pretty much set up, and you were able to pivot really quickly and successfully. So I'd be interested to hear about those metrics that you measured, in terms of, I don't know if you had any metrics for the instructors and supervisors themselves. It sounds like you definitely had some for the students, graduate students. Can you tell me about what those metrics look like?
Well, we did, and we didn't evaluate the faculty. This was an evaluation of student learning. So it was a pre-test, post-test, and then a survey asking the students to kind of give their feedback. So both qualitative and quantitative on the student end. And we did have some pretty good findings where the students were reporting that the training, that they felt like, more comfortable of what to do. And of course, many of those same barriers that you see from people who've been in the field for quite a long time, right? It was harder. I couldn't connect. This isn't kind of what I wanted. We did have several students who, said with the pandemic, oh, I'll wait it out. This will be over and then I can come back and do this. This is the world now, and counselors have to be flexible. Mental health professionals have to be flexible.
Yeah. Let me say something about that. This has always been a curiosity of mine. I don't know that there's any research on this, but there probably will be in the future. But behavioral health professionals, people that want to be psychotherapists, they envision themselves getting into a program. They envision themselves sitting in the same room as a client, right? So they get into the profession expecting that's what they're going to be doing. So when they have to transition, like, no, you're not going to be doing just that. You're going to be doing it virtually. They're going to like, well, I didn't sign up for this, right?
Mhm.
I'm thinking that 10 years from now, when we have new students coming into programs, they're going to be coming in expecting to be doing virtual work, right? So they're obviously already motivated. I wonder if there's going to be a shift there, right? Because I think those expectations are starting to shift. So your results showed that. Did their confidence go up after training? Like, can you tell us kind of what those metrics look like? It sounds like they appreciated the training, felt more confident, but some of them stated that, hey, this is not really what I signed up for.
Mhm. Yeah,
Okay.
that was basically it. There was a difference in the post-test scores went up, and what we did was we did the pre-test before they ever entered practicum, and then they do the training, and then they complete their practicum. And at this point, we're still pretty much, I would say, 98% virtual, because again, like once clients realize they don't have to drive anywhere, or it's convenient. So even if we're working with students who we're on campus and they're still like, no, I'm not coming in, I'll just log in from my dorm room, when it's like maybe 10 minutes away. But that convenience for them has certainly upped that. But then we did the post test after they completed the entire semester, so that they went through that process of actually doing it, of kind of struggling with some of those HIPAA compliance issues, with the ethical issues, with the certainly making sure their camera was appropriate, making sure they had a quiet place, all kinds of fun things I'm sure you've seen as well in your training, and seeing what kind of goes by. But they certainly reported feeling more confident, feeling as if this was something they were able to do. They may not necessarily want to do it, but they felt that they were able to do, and that they still felt they got a useful practicum experience. And I think that was, kind of the most important piece of it.
Oh, okay. Yeah. So, the president and provost wanted something, initiative that would kind of really make a difference. And it sounds like this significantly did make a difference. I would imagine your utilization of services has gone up, probably less no-shows like most organizations have seen. Has that been the case on your end?
Well, certainly the utilization went up once we kind of were able to, do advertising. I would say that, collegially, we were in a great place. So what happened was, of course, COVID hit. And initially, right, everything dropped off. Everybody kind of disappeared. We don't know what's going on. I don't know about this telehealth thing. This seems weird. Students unwilling. So there was certainly just tons of trepidation and crisis and trauma around all of that. Right. So one of the things we did was reach out to our fellow universities, because we had students in need to graduate. One of the things that happened there is there were clients in a lot of need, there were students in a lot of need. And so we initially worked out an ability for students to counsel each other in different programs. So, they were able to learn and kind of get what they needed to do a little bit more safe, but they were real clients. And then, yes, it got to the point where we could no longer do that, because the numbers of community-based clients and just students in our undergraduate at Central Michigan University kind of skyrocketed. So yes, and we also were working with a local college. So again, before COVID happened, there's a community college in Central Michigan called Mid-Michigan College that had also no mental health services. Didn't have the money for it. They knew their students needed it. They reached out to us. And so one of the first things we said is, hey, we have this innovation award. What if we provide them telemental health? They have no transportation to drive here. You can't provide transportation. We can't physically come to you. This would be a solution. So that was one of our actual plans, and it went into motion just obviously as soon as that happened. I think we've serviced about at least 80 of those students who wouldn't have access otherwise.
Wow, that's fantastic. Yeah. And there's been other graduate programs in the country that have done very similar to what you've done. They
Mhm.
launched telehealth, and then they provided it to the community, and their reach just drastically expanded. So now they're able to provide services to a whole lot of people within their state, right through the university, through telemental health services. Yeah, that's fantastic. So in terms of the marketing, you mentioned the marketing, right? So this is a new kind of service delivery model that
Mhm.
people weren't used to. So the marketing is key. And you mentioned the marketing in terms of getting the utilization. So what have you found helpful in terms of the marketing on a university type of atmosphere?
That's a really good question. It was one of those things where we had to pivot so quickly because we were
Mhm.
still like old school. You call up for an appointment,
Right. Yes.
right? Like
Yeah.
that's even where we were. So we had to quickly change our website. We had to create a login so that people can just very easily, get an appointment, sort of saying we're just telehealth. But I would say this was one of the examples where the need was so great that we really didn't have to do a whole lot of marketing, at least in the college communities, just kind of letting them know, hey, we're here and we're available, and here's our hours. And it kind of, we
You didn't
grew.
have much competition, right, to compete with.
No, I mean, and that's
Yeah.
the other bit. Again, mostly also because we're free.
Yeah. Yeah.
We're free. I know a lot of what I do know, and again, I can only speak to Michigan, is that the need did skyrocket, and individuals who would have normally been geographically restricted were no longer geographically restricted. So everybody's wait lists just exploded, and the need for mental health professionals has exploded. I mean, the U.S. Department of Labor basically expects the need for 700,000 more mental health professionals in the next 5 years.
Wow, it's unreal. Yeah, your
Mhm,
program's going to really expand.
mhm.
So what advice would you have for other graduate programs looking at, providing telemental health services or expanding or improving that area?
I think the first thing, and I really do mean this, is get the training. The training was really helpful. Because I think it's one of those things where I think a lot of people go, "Well, I have a computer, I have Skype, right?
Right, right.
I can
Yeah,
turn it on.
yeah,
I can do this." And obviously, there's a great deal more that goes into it, and things that I've been practicing for quite a long time, and learned things that I needed to learn from that training. And so I think the very first thing I would say is just get trained. Make sure that if you have the opportunity to do it yourself, you do. I had the advantage that I already had a caseload when this happened. And so I had to pivot pretty quickly as well. And so that training, again, serendipity, right? It's like I had the training. And
yes.
so I was, so now I can at least even say to the students, hey, I'm not just telling you to do this. I did this for, actually, it's been about 2 years now.
Yeah. Yeah. So, we hear, because we serve a lot of universities in the
Mhm,
graduate programs to provide telemental health training. And we hear from some of them that the faculty has gotten trained, but then they're sending the students out to outside organizations for their practicums and internships. But they have real concern about the supervisors at those clinical sites not being trained, not really knowing how to do it appropriately. So they're being kind of guided, modeled in a way that's not quite the way they ought to be doing things.
mhm,
Um, in your situation, you guys provide the practicum on site, right? So you have some control over that.
mhm.
Um, so I would assume you probably would think similarly. Do you send people out to outside sites, and have you thought about that in
We
terms of?
actually do. We have both, but every
Mhm.
practicum student gets the training.
Okay, yeah.
So irrelevant, yeah, irrelevant of whether they're doing it at the CCCD. I mean, that's where we were doing the program evaluation through.
I
But
see.
we're launching actually a fully online program in fall of 2022. But before then, we've had satellite students all over the state of Michigan. who would do their practicum. Because again, before 2019, everything was, I'm not driving 3 hours to see a client.
Right.
We do it locally. But what we did is we created this training with the understanding that it doesn't matter where you're doing your practicum, you're getting the training. The training's required. It's now part of our course. And that's one of the things we embedded into it.
I see.
And actually, as you're speaking, it's a really good point. We should probably embed it into our site supervisor training, which we can.
Okay.
We're required actually to do that. But I mean, obviously, we would recommend that they get something a lot more official, and they do the training as required and get this board certification. But certainly at least kind of going, again, like you can't use Skype, you can't just use Zoom, you can't just
right. Yeah. So you probably hear similar things that we hear, because a lot of students come back to us and they say, I'm working at this organization and I really am concerned about this and that because I learned this and that in your training. So we just kind of help them talk to their organization about, hey, I took this training, might want to look at changing this procedure, this technology or workflow or yeah. Excellent. Well, you guys have been super successful. So can other universities, those listening, reach out to you, those that are looking to kind of improve their telemental health services, et cetera, for questions?
Of course.
Okay, great. Yeah. And maybe one last question would be, what type of telemental health services do you provide on your practicum site? And what I mean is, you probably, you offer sessions through video. Do you offer audio only? Do you offer some sort of crisis situation service? Do you offer text-based, through like secure messaging through a platform? Do you interact through an app with clients? What are the offerings that you all have in terms of the technology used?
Yeah, our offerings are only video teleconference.
Okay. Yeah.
For a whole host of reasons, but I mean, one of the biggest is just for supervision and training of students, so that everything is recorded. Okay. And so all those videos are viewed by the supervisor, so we can ensure the safety of the client and the safety of the student.
I see. Okay. All right. Excellent. Yeah. Well, thank you so much. This has been very helpful. And those listening, your Dr. Pickover's information will be in the description of this video. Thank you.
Thank you.